Thank you.
Good afternoon, all. My topic for today is corneal ulcer a cause of dacrocystitis? No financial interest to declare. Corneal ulcer caused by infection is one of the leading cause of blindness worldwide, second value to cataract, and it is crucial to raise awareness about this condition as early detection and treatment can prevent vision loss. And the aim of this study is to explore the prevalence of corneal ulcer with dacrocystitis. And a study design of this study is prospective, non-controlled case series with inclusion of 58 eyes with the infective corneal ulcer. And the study was conducted between February 2022 to September 2023. And in inclusion criteria were patient having corneal ulcer in one eyes and no history of any lacrimal pathology previously. And after the positive diagnosis of corneal ulcer, the syringing of the lacrimal drainage system was carried out before any medical treatment, and lacrimal syringing consisted of punctal dilatation, lacrimal sac massage, irrigation with moxifloxacin eye drop to determine the point of obstruction, if any, and the medical treatment of corneal ulcer is initiated based on their clinical and pathogenic diagnosis, and surgical treatment was performed when the infection could not be controlled by medical treatment with the help of corneal specialists attached to our center. And if there is no progress in the healing of corneal ulcer after 3 to 4 weeks of treatment, we re-examine the nasolacrimal system, and if there are symptom of dacrocystitis, systemic antibiotic for a week, and if there is still no improvement, we perform DCR. And the outcome was very satisfactory, and after 3 to 4 weeks of DCR, the infection was under control and the corneal epithelium was healed. These are few examples. Among 58 patients, 5 were diagnosed with dacrocystitis at the end of 3 to 4 weeks, and one case was successfully treated with medical treatment while remaining 4 required DCR. And we conducted this prospective study to explore the possible link between corneal ulcer and dacrocystitis. Only a limited number of published studies indicate a high risk of dacrocystitis due to corneal ulcer. This is a study from North India by Juhi Khatun. The prevalence of dacrocystitis was 19.5 per 10,000 patients for general population, and the incidence of acquired dacrocystitis was 15 per 10,000 patients. And according to population-based study conducted by Wu et al., the average annual incidence of symptomatic acquired lacrimal outflow obstruction in people above age of 5 years was 0.03%. But in our study, alarmingly, our data shows 8.6% of the eyes with corneal ulcer suffered with dacrocystitis. More importantly, patients in our study had no history of dacrocystitis previously. That is, they were diagnosed with dacrocystitis for the first time only after 3 to 4 weeks of corneal ulcer. And this is the distribution of different isolates. Staphylococcus aureus and fungi are the most common isolates in our all the cases, and typically staphylococci are associated with dacrocystitis, and fungi are related to chronic dacrocystitis in China. And conclusion is corneal ulcer can lead to obstruction of the lacrimal duct, particularly in the lower canalicular region, causing dacrocystitis. And to best of my knowledge, corneal ulcer can lead to lower canalicular obstruction, while dacrocystitis can worsen corneal ulcer by delaying tear film clearance and altering microbial flora. Although various studies have been conducted on the treatment of dacrocystitis and corneal ulcers, but still the scientific community has not yet recognized the association between corneal ulcer and dacrocystitis. Although there are many studies on corneal ulcer causing dacrocystitis causing corneal ulcer. And the take-home message is, while treating the corneal ulcer, please assess the blockage of lacrimal duct. Thank you. And
but it can be done if everyone doing a syringing or proper assessment of the NLDO, then only we can think it is due to the corneal ulcer, or it may be a vice versa. Either it is a NLDO is responsible for corneal ulcer. In our previous knowledge, it was thought so NLDO is the main cause for corneal ulcer. But you are now highlighting is, thank you for that. Maybe a vice versa. It may be a vice versa, but for any day we proper methodology to assess the patient, then only we can highlight it all those points. So if we do, how many of your patients are fungal corneal ulcer?
fungal 5. Actually, I want mentioned the
And
5.
is there any patients you find it out during the dacryocystitis? It is a fungal element.
I will see the total log portion that I said. Because time was very limited, that's why I
Yes,
haven't included
yes.
all that.
We can look because maximum number in our clinics is a fungal corneal ulcer generally. Then in our setup, in our background, Indian background, than bacterial. Bacterial generally may improve little. Those who are attending
As I remember, 1 or 2 cases of Candida. I had.
Candida, yes. So we can rethink in culture all, then it will be a very good study.